Hello, this is Dr. Do again. This video is still on alphabetic list of problems on letter L. So I have been spent some time talking about different kind of conditions, about the lung diseases, start from the pneumonia, different type of pneumonias, and also introduce the basic structure of the lung, and also talk about asthma. So today I'm going to talk about another lung diseases, emphysema. Is there any emergency situation associated with this emphysema? Yes, from the hypoxemia to the heart disease. I'm going to explain this. So what are the signs to look for to see the emergency? You probably know it because this is one part of the COPD. If you had it, it's not a short time develop. It takes time to develop this emphysema stage. So I'm sure your physician already alert you what kind of the signs you're looking for to see the emergency. Difficulty breathing, of course, profound amount of sputum, or particularly if the sputum with like a pink foamy like that, indicating the heart is involved, is associated with the heart failure, and also change the color of your lips and difficulty breathing, may or may not have chest pain. So any of those signs, you need to call your physician right away or go to the emergency room as soon as possible. Of course, the oxygen is definitely going to improve your symptoms and make you feel better. Or if it's associated with heart failure, then medication to manage to get rid of extra waters, that definitely will help you to feel better. Any of conditions of this emphysema can manage at home? I think it's probably I would say no, because even though you're not hospitalized, even though you're not seeing a physician for a while, but still you're monitored on your medical team and with dilators or any other medications in hand for the maintenance of your lung function. So you cannot manage at home. Has to be under what I'm going to say it again. Why saying manage at home means using non-prescribed medication from over the counter or regimen or remedy you had it from somebody else. But for this emphysema, you cannot do it. It have to be managed by the physician through the prescribed medication, oxygen, any other medications. So this is about emphysema. Let me just briefly talk. I already introduced about the lung structure, and I'm going to talk a little detail on this lung structure associated with the function. So I already mentioned the alveoli, the basic function unit of the lung is a little sac, and it's kind of open and closed. So usually a normal lung is kept open so the air can come in. And along the sac, there's exchange membranes for the gas to pass freely, oxygen or carbon dioxide to reload oxygen to the blood and release the carbon dioxide to the air. And this sac is maintained because there's no cartilage or anything to keep it open. It just maintains opening by a chemical called a surfactant. This surfactant is secreted by there's different type of the alveoli cells, by the type 2 alveoli cells. So this surfactant will just maintain the bubble, the sac of the alveoli, keep it open. So if I mention this, you probably heard about this respiratory distress syndrome, either from adult or premature infant. If they do not have this surfactant, then the collapse of the sac or alveoli will cause the lung disease, cause difficulty breathing. So this is just to introduce the concept. And the emphysema is the extra air. So the alveoli become enlarged. Their extra air just stored or deposit or just staying in this alveoli cannot be expelled out. So that's caused the emphysema. Basically, their extra airs remained in the lung. That's actually the direct translate of that emphysema means. Emphysema, that's what it means. So what are the risk factors? Of course, smoking, or previously bronchitis, especially chronic bronchitis from the cold area, or a history of asthma, and also the bacterial infection, viral infection caused the bronchitis not very well managed and with the complications. And also the genetic, there is a alpha-trypsin deficiency can cause this emphysema. So I recalled when I was young, I saw so many emphysema patients around me. I think that's probably, and a lot of bronchitis. So I think the weather caused the cold weather caused the bronchitis, and asthma caused the constriction of the airway can contribute this emphysema. But there's no clinical trial or anything, but just the risk factors: smoking, genetics, and chronic bronchitis, and also other infections. So this is about the emphysema risk factors and the etiology. In terms of the symptoms, and of course difficult breathing, like if long term we'll have this barrel shape of the chest because the air expanded in the lung all the time, and also you may or may not hear wheezing, and there, if long term hypoxia can have the clubbing shape of the fingers and cyanosis. So anyway, and these are the presentations. Of course, diagnosis has to be made by the X-ray or lab test, blood gas test, for example, and treated really management. Usually, this emphysema has a risk to bacterial infection, so has to manage. Use oxygen, antibiotics to improve the symptoms. And in terms of complication, the worst complication for this emphysema is the heart failure, which is called cardiopulmonary, special caused by this emphysema. It's a heart failure will have this edema all over the places, and also sometimes if the fluid back up to the lung, can hear the rouse in the lung, like the bubbling, like the water, the air through the water, like bubbling sound. And it can be very serious to hypoxia, difficulty breathing, especially at night, to wake up to gasping air in the window. Those are the medical terms, and a lot of have to sleep on the pillow. So I think I have mentioned it before, cardiopulmonary, if you follow my other videos. So anyway, this is about the emphysema, very common lung diseases. And I think the take-home message is if you have the upper respiratory infection, if you have bronchitis, manage as soon as possible. Do not wait until it becomes chronic. And smoking, of course, because one of the most important risk factors is smoking. So long-term or remote smoking or secondary hand smoking. So try not to smoke or quit smoke with help with your physicians. And also, if you have genetic this enzyme deficiency, I think need to follow up with your physician and to manage accordingly. So this is the general introduction of this emphysema. Particularly, I introduced the alveoli structure and the surfactant to keep it open, and also the management. In terms of management, has to be managed. Call your physician as soon as possible. So I'm going to stop here, and I hope it helps. And thank you for watching. I will see you next time.